Good afternoon, everybody, and a very, very warm welcome. Thank you very much for joining. My name is Kendall Harrison. I am a Pharmacovigilance Information Coordinator at the Medicines and Healthcare Products Regulatory Agency. We also have Mittal Jadeja, one of my colleagues on the line, who will be manning the chat. So if you have any questions as we run through, please enter your questions there and he'll do his best to answer you. So today you're going to be learning about what the yellow card scheme is, what we do and why it's important, and how you're able to help us. See how you can do this easily through your EMIS Web through work, and also get an update on the latest work we've been doing with the COVID-19 response. So the yellow card scheme started back in the 1960s. I'm sure many of you will be aware of the thalidomide crisis, when pregnant women were given thalidomide for nausea and morning sickness. They started to see side effects to the babies with congenital abnormalities. And at the time, there was no way or centralized way of alerting authorities to these suspicions. So it really took a few years before anybody was able to see this trend and put two and two together. And so at this point, once it was identified, we saw that there was a really important need to have a centralized reporting scheme so that people could alert the authorities to their suspicions and take any actions as necessary. So the yellow card scheme was created back in the 1960s. Subsequent to this, one of the first in the world, and the science around this is called pharmacovigilance, with the WHO describing this as the science and activities relating to the detection, assessment, understanding and prevention of adverse effects or any other drug-related problems. So it's quite a wide scope. So the yellow card scheme was established. Initially, it was just for doctors and dentists, and gradually the scheme expanded to include all healthcare professionals. And importantly, in 2005, we began a pilot to see the benefits that patient reporting could add to the scheme. What we saw is that patients could add a huge amount more granularity to the impact of side effects and how that was affecting their day-to-day life, which has given us a really rich resource to be able to analyze side effects better. And subsequently, they were launched into the scheme. So now anybody can report to the scheme any suspicions of side effects that you may have. We receive about 45,000 reports annually, and we try and grow this both in quantity and quality as much as we can. And Mittal, who's on the line as well, is very key in kind of the strategy to kind of build this up. So what happens when we receive a report? I could probably spend all day talking to you just about this slide, but essentially we receive the reports. These then go through a process called signal detection, which is where we assess the reports alongside other reports in our database to see whether side effects are being reported abnormally regularly for a particular drug. This can kind of signal that we need to look into something more. And if we detect a potential side effect, we will then review this to consider the benefit-risk balance of that product. We do risk management of that to ensure that the benefits still outweigh any risks, and take any actions to communicate our actions. This can include things like updating product information for medicines. There are many ways in which you can report to us. Free post has been around since the beginning. The picture in the top is the printout you can see in the back of your BNF. For any of you that still have a paper copy of the BNF, you can also just report to us a free post through the post anyway without paying. You can email us, you can phone us. Our phone lines are open 9 till 5. We have a yellow card website. We have a yellow card app, which was launched a few years ago, which you can download, and also has information with drug side effect information and details on the reports that we received. And then importantly, in the context of this webinar, we have integrated healthcare systems. So we know that yourselves as healthcare professionals, or indeed if you're patients on the call, the information that you store about patients is already in your clinical systems. So the information such as comorbidities, past medical history, and other drugs. So instead of us asking for you to enter that information into a yellow card report, we ask that you can report through your own clinical system so that the database essentially pulls across the important information And you really just have to put the minimum level of information on the suspicions that you've had about this particular drug or side effect. So we are very pleased to announce or remind, I suppose, that we integrated into EMIS Web earlier this year. We started off with a pilot back in November, which saw a number of clinical practices taking on the EMIS functionality to see how this worked and feedback any improvements that needed to be made. Subsequent to this, we launched across the whole of England into 4,000 practices back in January 2020, which went successfully. For Scotland, Northern Ireland and Wales, we are working towards this integration, but this isn't currently available, but we are trying to improve this as soon as we possibly can. Since the integration, you can see the graph there that we've been receiving between about 20 and close to 50 reports per month, which is fantastic. It really shows us that people are using the system to report to us and that these are coming across successfully. It's safe to say that we were expecting probably a few more reports than this, and I'll come on to one of the reasons why. But as a bigger trend, I suppose, you can see since March there was a fair dip, and a lot of this is because of the pandemic. We know and understand that obviously healthcare professionals at the moment are stretched even more than they usually are. And so reporting has dropped across all reporting modes, across all reporting groups. And so we'll have to work hard to kind of improve this going forwards when people have that more time. But we know that this is a contributing factor to the kind of reporting levels that we're seeing. There was a lot of information that went out at the time, so hopefully some of you would have seen this, but what this has meant is that in primary care, we're actually integrated to 93% of clinical systems, which is a really great place to be. So this slide shows you EMIS Web. I'm sure most of you on the call are far more familiar to it than I am. But this shows you where you can find this yellow card functionality and how to be able to report to us. One of the things we've had fed back by a number of people is that it's hard to find the yellow card. So I'd like to take the opportunity on this webinar to ask you as users, if any of you are users of the EMIS Web, to kind of contact EMIS now to ask for this to be more noticeable, more signposted, more accessible. But hopefully through this webinar, you'll be able to see where it is and be able to find it fairly easily. So the guidance on the right-hand side shows you how to access the yellow card functionality. You can access the medication screen, click on the EMIS logo and select medication. If you don't have a patient, you're prompted to choose one using the patient find, and then on the ribbon, click patient actions and select yellow card. When you select this, you'll see the fields that you're requested to populate. Many of these data, as I said, would already be filled in with the patient's details, so you don't need to refill in all of the details, just those in relation to your suspicions about which drug and which side effect you think they've had. At the bottom, there's a link which will take you to further guidance on how to access this. And if you click on it, there's written guidance, but also a really handy film video which shows you the steps to process it. If you can't click on the link, then if you just Google EMIS Health and yellow card, the first article that pops up is a news article through EMIS, and within that there's some links to help you see that. So please access that. Next, another way in which we're receiving reports is through the COVID-19 reporting site. So clearly, a lot of the work has been going into seeing which therapeutic agents are going to support the management and the clinical management of patients and save lives in this area. So whilst we have many ways in which reporting, we wanted to make sure we could also accept reports for COVID-19 drugs that were being produced or modified to have an indication for coronavirus. And so back in May, we launched the coronavirus reporting site. And it's important to know, I suppose, for anybody using the EMIS site, All of the reports come into exactly the same database. Appreciate you might not always know which route to report through, and essentially the take-home message is it doesn't matter. The information will all come to us, it will all come to our database and all get reviewed. The benefit that the new reporting website has, and the links at the bottom of the page, is that we ask quite specific COVID-related questions, such as whether the patient has had symptoms, whether they've had a test, and what the results of that test were. So it gives us greater granularity to ask those questions. We also have, through the Yellow Card app, we have surfaced the coronavirus reporting form. So again, if you have the app, you can report this way for anything coronavirus related. And I guess as a plug, if you don't have the app, it's a really useful tool, not just for reporting, but for collecting information and seeing news in relation to medicine. So please go ahead and download. It's free to access. So I've talked, I suppose, mostly about how reports are received to us and how you can help us in reporting those. But it's important to say what we actually give to yourselves as well. So we have a raft of ways in which we might want to communicate, and it all depends on the action that's being taken. So firstly, we might update product information, whether it's because we've got a new side effect that we've identified, or if there's a new contraindication, then we would add these to the product information. We also manage the central alerting system. So if you ever have had a CAS alert, then these are quite direct communications to specific professions, so that we can target communications. We also coordinate the Dear Healthcare Professional letters, which often come from pharmaceutical companies, but again, we'll explain drug side effects or an alert that needs to be explained. Next, we also have an important drug safety update. Again, you can register to these. I appreciate there's a lot of alert fatigue, but this will be a monthly bulletin, and it will basically highlight the most important drug safety issues that we've identified, and it will tell you the background to the side effect, and also what actions as practitioners that you should take and what's recommended. So if you'd like to subscribe to that, you can search drug safety update and you can put your email in, and then you'll be sent that directly. But also, if you have the app, they will also be within the news section, so you can see that without having to get those emails in your mailbox. And lastly, we've taken to social media in the last few years. Served as a really great way for being able to extend our advertising of the scheme, but we know that still lots of people aren't as aware of the scheme as we'd like. And so the social media side is giving us another way in which we can access people and make them aware. So feel free to follow us on Twitter, LinkedIn, for example. In particular, we have over the last few years been involved in an international pharmacovigilance campaign to support international reporting of side effects that we coordinate with the World Health Organization. So in November time, look out for those tweets, and please retweet and do social media if you're happy to boost up those numbers there. The other area that we publish, which I think would be quite useful for you to be aware of, is our interactive drug analysis profiles. So this is a publication of all the reports that we've received on suspected side effects, broken down by drug. And as you can see on the left-hand side here, it's also, you can filter the data depending on certain factors. It's important to note these are not confirmed cases. We can never really confirm a drug side effect, but you can see the reports of suspicions, and it can be quite a useful tool for you to be able to see that data. And finally, we appreciate any support you can give to the scheme, whether that's your time in reporting, if it's discussing it with your colleagues and your family. We would be really grateful for that support. There's some resources up there that might help you. So we have animations you can put in your waiting areas to help patients not get too bored whilst waiting. We have posters that you can print out and put up. We also have a number of accredited training modules. So if you're looking for extra CPD modules or points, we have one specifically for doctors, pharmacists and nurses. So go ahead and check those out. And there's also a lot of information on our website, so please go to that. And if you have any specific questions, I'm happy to receive those via my email that I have at the bottom of that page. So I'll leave it there, and I hope that's been valuable. Please do get in touch if you want to know more. We'd be very happy to kind of engage with that. So thank you very much and enjoy the rest of your days.